Dr. K K Aggarwal, President of the IMA, is now joining us on the phone line. Dr. Aggarwal, first of all, how can these parents be helped? You know, they've lost their child and now they've been given a bill of 16 lakh rupees. What's also hurting the father at this point is the insensitive questions that, you know, they have to fill out in forms. He's clearly stating that, saying the questionnaire that he has to answer asks him whether they were involved in the death of their child.
I can only tell about the rules and regulations. That according to Medical Council of India Ethics Regulation, the charges have to be explained to the patient and their relations. Consent needs to be taken. Daily bill needs to be given. And if the patient cannot afford, then the decision accordingly needs to be taken by the hospital and the patients together, whether he continues in some other hospital or not, without compromising on the health and without compromising on the status of the patient.
But Dr. Aggarwal, one second, Dr. Aggarwal, I want to interrupt you there. 1 second, sir. You said, you know, the parents or the patient's family needs to know whether they can afford that health care. Now, you know, people are left in such a situation when their loved one is in the hospital that they agree to pay whatever the amount is. And that clearly is misused by hospitals. This is not the first case, sir. So surely the IMA needs to step in somewhere.
No, what I am trying to say is, for every discrepancy, the parents can ask for an inquiry from the State Medical Council. They can also approach Indian Medical Association to go into it. But the law is that no hospital can produce a bill without giving a daily advance and expect the patient to the bill. If it has not been done, it's wrong. Then the hospital is unstable. And if at any given time the hospital finds that the patient cannot afford a treatment, it becomes the duty of the hospital to find a bed in a government hospital without compromising the health of the patient to transfer.
But Dr. Aggarwal, I'm questioning that very premise of that argument that, you know, the patient's family needs to know the cost. They might know the cost while the patient is in the hospital and may agree to that cost because they are in such a difficult situation. But Dr. Aggarwal, is it justified that 16 lakh rupees bill is given to a patient's family? Their child, they've lost their child, and the child, according to the hospital, suffered from dengue.
Not a matter of concern to Indian Medical Association unless we find that the bill was overinflated, investigations were overdone, and the blood was not required, it was given. That has to be investigated by the council. That I cannot investigate like that.
Okay.
My thing is whether the treatment was fair or not, whether over treatment was given or not, that it be investigated by the State Medical Council.
All right.
That is not a subject where you and I can decide.
Okay.
Without going through as long as every charges has been explained to the patient, consent has been taken, and the subject to at any time the patient can ask for a grievance redressal where they can go for exploration.
All right,
that's the only answer I can give as an Indian Medical Association.
Right.
Otherwise, what will happen is, listen to me, every case of transplant, every patient of ICU, the bill always comes to 5 lakh, 10 lakh, 15 lakh. IMA cannot go into the details of every bill. The guidelines are very clear that hospital has to give an estimate to the patient in advance.
Okay.
In emergency, they cannot refuse.
All right.
And if the patient cannot afford, it is the responsibility of the hospital to transfer them to the nearest government hospital without compromising on the.
Okay. Dr. Aggarwal, many thanks for speaking with us. We do apologize for that poor audio, but Dr. K K Aggarwal was making the point that the IMA cannot really act in this matter unless and until it is proved that the bill was actually inflated. But just think about it, 16 lakhs for a patient who was suffering from dengue, and this hospital was not even able to save the 7-year-old's life. Today, the parents are faced with this inflated bill, which is full of consumables, and the hospital simply says that this is as per protocol.